Hey future doctors, welcome back to our channel Teddy Guides You. Have you ever wondered by seeing red eyes of your friend? Don't worry, today we are going to deal with a very important and common disease, that is scleritis. Okay, the deep red eye. So what is the definition of this scleritis? Scleritis, the name itself is saying it is inflammation of the sclera. Which type of inflammation? S for serious and this is P. P for painful. Serious painful inflammation of sclera that can causes loss of vision if untreated. So much rarer than episcleritis. In the previous class I dealt the important points about episcleritis. Please go back and watch the previous video about episcleritis after this class. So, it is much rarer than episcleritis affecting older men, whereas episcleritis affects younger adults. This scleritis affects old adults. Okay, it is more common in women, same as episcleritis. So, causes are big. A for autoimmune disorders like rheumatoid arthritis, PANSLE, Wagner's, ankylosing spondylitis, and I for infections like herpes zoster, staph aureus, etc. and metabolic disorders like gout, thyrotoxicosis during burns, radiation surgery, and some cases are unknown like idiopathic, and in cases like granulomatous disease, example sarcoidosis and leprosy, they leads to scleritis. Okay, so what is the pathology here? Remember the sixth one, granulomatous disease. Like there will be formation of granuloma. So it is chronic granulomatous inflammation. Granulomatous inflammation. Granuloma will also contain necrosis. Majorly in TB it is caseous necrosis. Here you can see fibrinoid necrosis and collagen destruction. And if you observe, you will see giant cells like multinucleated cells surrounding the epithelioid cells in granuloma. So here also you will see giant cells and you will see lymphocytes. In granuloma you will see collar of lymphocytes and macrophages also see. It is very easy to remember the pathology of scleritis by remembering only granuloma. Okay, so what are the clinical features here? Here you will find pain. So as it is deep boring, so you will see deep boring and pain radiates to jaw or temple and wakes the patients up at night. Okay, so it causes discomfort during sleeping hours. And you will see redness, pain, redness, photophobia, lacrimation and decreased vision. So it is a major cause for loss of vision. Okay, now let us discuss some of the important points. This scleritis is divided into two types. First one is non-infectious, second one is infectious. This non-infectious is further divided into anterior and posterior. This anterior is further divided into non-necrotizing and necrotizing. Okay, here non-infections divided into anterior and posterior. This anterior is again divided into non-necrotizing and necrotizing. These non-necrotizing is again divided into diffuse and nodular. Okay, diffuse, the name itself is saying it is most common and widespread. You will see the redness is widespread throughout the eye. But whereas in nodular condition you will see an hard and immovable purplish nodule near the limbus as usual in nodular episcleritis. In limbus, near the limbus you will see nodular immovable purplish nodule, that is non-necrotizing. In necrotizing you will see both with inflammation and without inflammation. In posterior scleritis, which is very rare as compared to the anterior scleritis, behind equator it is sometimes diagnosed and you will see exudative retinal detachment, macular edema, proptosis and restricted eye movements in case of posterior scleritis. And the last one is infectious, which is 5 to 10%. Here you will see purulent exudates, ulcers, painful nodules, fistula formation. So these are the important points that you must remember here. Next, let's discuss about investigations. Investigations are nothing but rule X-ray, RA factor, ANA factor, and complement factor in case of autoimmune workup, and you will also investigate for uric acid in case of gout, and LE cells, VDRL in case of syphilis, and in case of inflammation you will see for CBC and ESR, and you will see X-ray of chest, sinuses, and sacroiliac joint. Okay, according to the main cause of the scleritis you will do the investigations. Okay, for treatment is also different for non-infectious and infectious. Non-infectious you will go with steroids and non-infectious you will go with steroids, NSAIDs, and immunosuppressants. Whereas for infectious, aggressive antibiotics or antivirals can be used depending on the type of organism causing the scleritis, and surgical treatment can also be done. So these are the important points that you must know about scleritis as a medical student. Hope this video helpful. Consider subscribing to the channel, dedicates you for more interesting and short videos like this. This is Harshita signing off. Thank you so much.